3, 2, 1. And I'm hitting the button to go live, my friends. Okay, we are back. Sorry, we got cut off there. What I would like to do today is just review some science of the week. There's been a lot of really interesting stories and really crazy things going on in the world right now. And I thought there was a really sort of auspicious timing of just a few hours ago. It's less than 3 hours ago. The CDC had recently updated and changed their mask guidance. And I thought the timing was really interesting. And I just want to share with you a few of the stories about this. And it's not just me who thinks this timing is a little bit auspicious. And what I mean by that is earlier, I think it was Wednesday night, late Wednesday night, Eastern Standard Time, Vladimir Putin and his troops from Russia had invaded the tip of Ukraine. And I thought it was really interesting that Dr. Rochelle Walensky had sent out this tweet late last night. Again, with all of these sort of incursions going on in Eastern Europe. She says, at the CDC, we have been analyzing the COVID-19 data and shifting our focus to preventing the most severe outcomes and minimizing healthcare strain. I thought, well, that's quite interesting because, again, the timing of this, with all of the news coverage, with everything that's going on in Ukraine and Eastern Europe and things of the sort, I thought the timing is crazy. Then, as if things couldn't get any crazier, we have this recent change with regards to the face mask guidance from the CDC. So this is just it came out 4 p.m. Eastern Standard Time on a Friday. Think about that. Oftentimes when you see sort of changes to rules and policies, usually and often books are frequently launched on a Tuesday, right? A Tuesday is generally sort of the day when things would get launched, and you have Friday at 4 p.m. right at the sort of the peak here with everything that's going on in Eastern Europe and Ukraine and Russia and all this stuff. So it seems like, gosh, if this was a planned strategy, if the intention was to slowly roll off the masks based upon changes in science, changes in community transmission, changes in data, why Friday at 4 Eastern Standard Time? It's crazy. Now, here's the thing. It's not just me that is sort of scratching my head with regards to the timing. There are other physicians on Twitter actually saying, hey, it looks a little crazy. So here's a Dr. Patel. Okay, Dr. Patel, who is a very mainstream doctor. I have been following her work and related doctors on Twitter with regards to face mask guidance and all of this, vaccinations and COVID trajectories and everything. And she says, and just like that, boom, literally within minutes, the CDC's website changes with regards to community transmission and risk of community transmission, the whole thing. So to me, it's a little, I don't know, I'm looking for your input here. Look, as you know, my biases are trying to be honest, trying to convey science and rely upon data and statistics and clinical studies to influence health policy and the health of other individuals. And then what do we have? We have seemingly a distraction over in Eastern Europe. And then we have the situation where, all of a sudden there's this rollout and this sudden shift and change because just a few days ago, Dr. Anthony Fauci, right? Many of you have seen him on television. He said this about masks. Now, especially amongst children. And again, the CDC is changing their guidance for children. So this is literally 4 days ago. 4 days ago. Actually, before I share that clip, what I want to share is this. This was an article from, of all places, the New York Times. Okay. Now, if you would have asked me a year ago, hey, Mike, do you think the New York Times would ever be critical of the CDC? I would say, no way. There's not a chance that the New York Times is going to be critical of the CDC. So this was a viral news story earlier this week. Right? The title here, just in case you're listening to, is the CDC isn't publishing large portions of data of the COVID data it collects. Okay. So, and they interviewed a lot of different, healthcare practitioners and doctors, many people who have been really interested in COVID-19 and so forth. For example, Dr. Daniel Jorgensen, the agency's deputy director for public health science and surveillance, said the pandemic exposed the fact that data systems at the CDC and at the state levels are outmoded and not up to handling large volumes of data. CDC scientists are trying to modernize the systems. So we've had 2 years to modernize the systems, but I guess we still don't have adequate systems to modernize that and so forth. So people are really being critical of the CDC. In fact, Jessica Rivera, I follow her on Instagram, very pro-vaccine, very pro-public health. She says, we have been begging for this sort of granularity of data for 2 years. Okay, she says, as an epidemiologist and part of the team that ran COVID Tracking Project, an independent effort that compiled data on the pandemic until March of 2021. She says we're in much greater risk of misinterpreting the data with data vacuums than sharing the data with proper science communication and caveats. So again, I think it's quite interesting when you have this viral news story that was published by journalists over at the New York Times. You have very sort of vaccine and pro-masking and pro-social distancing and lockdown individuals being critical of the vaccine. Being critical of the CDC. And then you have 4 p.m. Eastern Standard Time on a Friday. You have all of a sudden this abrupt change. And so you can actually go to the dashboard. Here's the dashboard in my community. Okay, you can go to CDC's website. You can look at the dashboard. You can type in your state and your county. And then what comes up is the community spread. Okay, so let's hear from none other than Dr. Anthony Fauci. Remember, this is a clip from literally 4 days ago. Okay, so remember I don't know how the science changes. Literally a sweeping change in the science in 4 days. So here's Dr. Fauci.
Many states are easing school masking rules, but it could be April before vaccines are approved for the 5 and under crowd. Is going without a mask safe? Well, the president's chief medical advisor, Dr. Anthony Fauci, says he's not so sure of that.
It is really not prudent to pull masks off children. You don't want to say it's an absolutely wrong decision. It's understandable why people want to take masks off the kids. But right now, given the level of activity that we have, it is risky.
Many states are...
So as you heard right there, it's risky. It's risky. This was 4 days ago, my friend. So it was risky 4 days ago to take the masks off. But now the CDC says, well, look, guys, look, everything is good. It's not risky anymore. 4 days later, boom, it changes just like that. Remember, this is Dr. Patel over on Twitter. You can follow her over on Twitter. Thank you for sharing this tweet. So the minutes later, it goes from red all over the place, dangerous, don't leave your house, oh my gosh, wear a mask and wash your hands, to, well, we're good to go. Nearly 70% of the U.S. population is in a location with low or medium COVID-19 transmission. So it begs the question, what influence did the threat or the news coverage on a potential world war, with Russia invading Ukraine and then all sorts of chaos, in Eastern Europe, what sort of influence did that have on the release and change in the sudden change in guidance and recommendation when it comes to facial coverings? These are simple questions, and I ask them not because I want to, go into the land of conspiracy theories, not because I have no trust whatsoever for our government. I simply want, and I know you do too, you want truth, you want objectivity, right? We want to be able to trust the institutions and so forth. And I guess a mistake that a lot of us have made over the past couple of years is we've paid a lot of attention to the news and the shifts in the narrative and the coverage and the changing of the tune. And then we start to see these inconsistencies, right? Fauci 4 days ago said there's too much transmission. We cannot take the facial coverings off. Literally a few days later, the whole thing is sort of changing, and you can go on your county, where you live, and if you have low transmission, then I guess the mask can come off, which is just crazy to me because less than 2 weeks ago, Dr. Rochelle Walensky, the same individual who runs the CDC, who tweeted this out last night, and I have a few things I want to mention about this in just a moment. But less than 2 weeks ago, you can Google the news stories. She said it is as many blue states, as I think Washington, D.C., Boston, Illinois, Chicago, L.A., and so forth. They have announced that they're going to, they've rescinded the mask mandates and all, right? And she said, well, it's too early. We have too much transmission. We have too much spread. So it's crazy to me that 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 all this stuff is going on, and I think we should all be asking questions. Again, if this is truly about the science. So, friends, I just want to welcome you all back. If you're here live, thank you for tuning in to Friday Night Fearmongering. This is, I think, the 4th or 5th season, if you will, episode where we've done this. Honestly, it seems like the COVID thing is just, Vladimir Putin cured COVID, right? So maybe we don't have any more Friday Night Fearmongerings because the science is changing rather quickly. So we are going to continue on, my friends. But first, I want to thank you for being here. If you enjoyed this video, hit that like button. Also, my friends, our sister company, Myoscience, we have rolled out a new product. It's very popular over at myoscience.com. Here's a few recent reviews. If you intermittent fast, if you go in the sauna, or if you exercise, you might like this formulation. A lot of people who exercise or go in the sauna or fast, they do quite like the electrolyte sticks. So you can use the coupon code podcast over at Myoscience. So just wanted to let you know about that. Now, we have a super chat here. We have That Kid C. Ricks says, many people are seeing through the baloney, but I find it interesting that Russia invaded Ukraine around the same time as the U.S. truckers are heading to D.C. Boom. You hit on something that I wanted to mention. And so I thank you for the super chat, and thank you for mentioning the fact that, the timing is quite auspicious. I do think there's a lot. Now, what I think is great here, my friends, is there's a lot of people that are waking up. I think the downside to the elite trying to sort of control the world and so forth is now more and more people are paying attention to all the subtleties, whereas before, I couldn't give a care about politics or the news. I didn't watch CNN or MSNBC or pay attention to the New York Times or any of these things. I was focused on a lot of research and health-related conversations, which I still am, of course. But I started to pay attention to the science that institutions released, and I started to see inconsistencies. I started to notice how politics has influenced the health care sector and doctors and physicians and even health policy. And you know what? I think a lot of people blindly trusted all of the institutions and agencies and so forth. And now I think we're a little bit more skeptical, and we're looking at things and saying, well, gosh, how could this be a coincidence or it. So, and look, we're all just looking for truth. And that's why so many people like to listen to videos and podcasts. If you look at Russell Brand's channel, if you look at Joe Rogan's channel, look at Tim Pool, all these people, even John Campbell going viral because they are sharing the truth. That's what we all want. And we have seen so much inconsistency. And I'm not insinuating that there's all sorts of nefarious intentions. I don't know what the intentions are, but we have seen inconsistencies. And I think it's important that we do expose these things and we talk about them. But yeah, definitely interesting times. And gosh, I've seen some crazy videos from everything that's going on in Ukraine, and talk about fear and putting things into perspective, right? We're so concerned about a respiratory virus with an infectious fatality ratio of 0.6%, right? And which is, that's all ages here in the U.S. It's much lower for people in different parts of the world. But crazy that, when you see real life problems, i.e. bombs and people getting shot and so forth, and tanks driving over cars in Ukraine, you're like, should we really be all that concerned about this virus that is becoming more and more benign and less virulent over time? Probably not, right? So, yeah, it's crazy to me. And so anyway, that's where we're at. I'm going to get to your questions in just a moment, but actually there's a few studies that I do want to share with you. Because I know a lot of you are interested in the science and so forth. This was a really interesting piece in Science, the magazine Science. I would encourage you to check it out if you're interested in the biology. And this is about why some people die from COVID-19. And I'm not going to read you a bunch of quotes from this. I will break this down in a separate video. But I just wanted to sort of whet your appetite with this study, because we've talked a lot about immunosenescence and this fact that as we make poor lifestyle choices, if we don't exercise, if we don't manage our stress, if we eat processed food, if we, don't live a healthy life, we can accelerate the biologic aging process that is known as immunosenescence or inflammaging. And that was purported to be one of the main mechanisms causing some people to die and others faring just fine with regards to this infection. But it turns out that some people who get severely ill have an autoimmune-like reaction that causes them to become severely ill. So I thought this piece was really well done. If you're a science nerd and you like to read research, you might want to check this out, because they do talk a lot about interferons and autoantibodies and this loss of immune tolerance. And it really speaks to the other piece of Rochelle Walensky's tweet that I want to get to in just a moment. But it speaks to the fact that, you know, a lot of us have control over our body's immunologic responses and autoimmune disease trajectory. And so we should be focusing on that, focusing on all the things that have been ignored by many public health experts and governments the world over. And that is nutrition, sleep, relationships, right? Social currency really influences health. Like the friends that you have, the connections and the strength of those friendships really influence your biologic processes. I mean, they really do. Social connection and social isolation is as much a risk factor for many of the diseases that are likely to kill you and shorten your lifespan, even when compared to infectious disease, right? So very important, and we have destroyed the social fabric within our communities and all that, and it's not good. Important stuff, because we have influence over our immune tolerance. A lot of us have an intolerant immune system. We have an overexuberant immune response that can be problematic. So this is where healthy living comes into the equation. This is where exercise, stress management, eating real food, like doing all that really matters. So anyway, I thought this was an important piece to check out. However, let's get into a point that Dr. Rochelle Walensky over at the CDC says. At the CDC, we have been analyzing COVID-19 data and shifting our focus to preventing the most severe outcomes and minimizing healthcare strain. Okay, let's unpack that. Minimizing severe outcomes and healthcare strain. Okay, so we know that underlying health conditions contribute to the healthcare strain. If you're overweight, if you're obese, if you're hypertension, if you have uncontrolled diabetes, if you have autoimmune disease, if you have mild cognitive impairment, right? If you're weak, right, you're more likely to end up in the hospital and contribute to the hospital strain. So the strain on the healthcare system. Why aren't we mandating? We've mandated all sorts of crazy things. We've made kids wear masks, right? We've made people stay in their homes. We've closed businesses. Why can't we encourage people to start exercising? Why can't we encourage people to start eating real food? Why can't we get the crappy foods out of the kids' school lunch menus? I mean, what are we doing, my friends? If we're really serious about preventing severe disease and reducing the burden on the healthcare system, the strain on the system, you know, all these people that are tweeting and so forth talking about, well, the reason why we stayed home is to prevent the hospitals from being overfilled. They're not overfilled with healthy people who are exercising and eating real food. I can tell you, because I have many friends and actually family members who are physicians who do work on the front lines. And they always tell you the types of people that are clogging up the healthcare system are not exactly the healthiest bunch. So for all the people that want to, you know, the COVID zealots, right, who want to keep everyone safe and prevent the healthcare system from being overfilled, should be the biggest activists of nutrition, of exercise, of sleep management, stress management, all of that. But often, and I just saw this the other day. I know you see this stuff too. I was at the grocery store and I saw this family. They were wearing N95 facial coverings, and they were loading their car up, and there's an Audi A7, probably a $60,000, $70,000 car. Okay. And I was just curious. I'm waiting for my wife. I didn't want to go inside because I'm so sick of wearing these masks and dealing with getting in a fight with the manager and all this crap. So I just stayed in the car, right? She went and did the shopping. Okay. So I see this family, you know, they're wearing the masks, and I'm just curious. I look over, you know, I'm in the car waiting in the parking lot. My daughter and I are there. We just did some walking and all that. And they're loading up bagels, Cheerios, Pop-Tarts, Pringles. Like, it was like, if you paid me to go buy the crappiest junk in the store, that's what was in their cart. Then I watched them. They all got in their car. They passed around the hand sanitizer. They took the hand sanitizer for as though it will somehow prevent a respiratory virus, right? There still is perception that the hand sanitizer prevents the transmission of a respiratory virus. And then they took their masks off. And I just it's not really their fault. It's the public health officials and the media that have ignored all these things all along. And that's why you have so many people turning to channels like Joe Rogan, Russell Brand, John Campbell, High Intensity Health, wherever, because we see this stuff all day long and people have been misguided. So it's frustrating, but I know I'm repeating myself because you are frustrated by all of this stuff as well. So let's get to some of your live questions. A lot of great questions. My friends, hey, if you're here right now, please hit that like button. That just tells the YouTube gods and algorithms that other people that have similar interests might like your videos. And so that helps. Let me just check into the feed, make sure we're doing good here. And that is it. Okay. Keto Carb says, hate the fact that we cannot trust any of them. It's tough. Like, dude, what happened to science? And by the way, how is science ever going to recover? Some people are talking about this. Martin Kildorf and other people, Vinay Prasad, right? Because when you say, oh, the scientists, now there's like this stain. There's like this, it's like tarnished. When you talk about researchers, you almost think about some woke, radical activists, right? You're like, when we used to think about scientists, it was like, whoa, they have a PhD. They're in a laboratory. Like, oh my gosh, this is esteemed. And then now we're like, well, are they an activist? Are they, is their research like really thinly disguised activism? Or is it research? Like, we shouldn't have to be, science is this way, this modality, this apparatus to discern the truth and to make new and novel discoveries to help people better understand the natural world, right? It's a process. It's not just like, and it's never really totally decided, right? Okay, let me just give you an example. Around 1980, maybe 1985, something like that, there was a so-called free radical theory of aging. It was a theory. It was a model. It was suspected that free radicals created by intracellular biology, mitochondrial respiration and the thing, that free radicals really drove or accelerated the aging process. Now we know there's different hallmarks of aging. You have immunosenescence, you have telomere attrition, you have loss of proteostasis. So there's all these different ways in which the body can age. Yes, free radicals are a part of that, but it's not the sine qua non. It's not the only thing. So, we never, and I'm sure in 10 years, we'll look at our 9 hallmarks of aging, say, well, gosh, there's 18 hallmarks of aging. It's always evolving. So when you have these policymakers, when you have these media pundits with no scientific training, pretending as though they knew everything there is to know about community transmission or how the biggest one for me was any face mask will do, my friends. You have this homemade cloth face mask, that will work. Oh, you have a handkerchief that your mom gave you? Sure, throw that on. It's going to help, flatten the curve. You're like, give me a break. Now we have studies to show that, well, what was common sense back then, like, yeah, your cloth face mask probably not going to really do much of any good. We were deleted and censored and throttled back with our engagement for even criticizing the silly idea that these homemade cloth things were doing something, right? So the point being that I think we need to have a little bit more hubris. We need to be a little bit more modest and realize that, yeah, the science, we don't know every single thing. We suspect these different things. And, for example, this new piece in Science Magazine that I was just sharing with you, this is novel. There's a lot of speculation and suggestion that immunosenescence and accelerated cellular aging was the main reason why certain people got really ill versus not. And it turns out that there's an autoimmune-like phenomenon. So we need to have an open mind and so on. So anyway, all right. Should we continue to do these Friday night fear-mongerings? Let me know in the comments below. Let me know in the chat. Maybe we'll sort of pivot off COVID and all of that and talk about, I don't know, food, USDA, big food and all that. Okay, K-Dub says the state of Washington is stuck in April 2020. Look, yes, it is. Look, I just got back from Idaho last week. And literally, as I crossed the state line, so I was in sort of the panhandle of Idaho, doing some scouting for the hunting season with a friend, Anthony J. We went to hotels, we went to gas stations, we went to grocery stores. Not a mask inside. No one's wearing a mask in Idaho. You can say, "Oh my gosh, well the deaths per capita are higher." Blah blah blah. Right? Whatever. Literally, as I cross the border and I get into Colfax, Washington, which is just on the other side of the border of Lewiston. Okay. If you know Eastern Washington, you know Colfax. My stepmother was actually born in Colfax. And I'm seeing all these people walking around with masks on outside. It's like literally you go to Lewiston, Idaho, not a mask in sight. Maybe 10% of people are masking. You go to Colfax, Washington, which is a smaller town, and everyone's wearing a mask. And it's just like, it's insane how some of these states, like as we just had here, people are stuck in 2020. And it really sort of speaks to the fact that when people say they're following the science, are they really following the science? Or are they just following the fear? My daughter now, we're homeschooling her part-time. We're kind of straddling. It's kind of not the best strategy, but I'm trying to figure it out, So as an only child, I like her going to the public school to hang out with other kids, even though they're all masked and all this. But I realize that parents around here are probably never going to unmask themselves or their children. So I've, thankfully through friends, we've met homeschool groups, and we were at this big park today where they did homeschool outdoors and just played. She had a great time. But there was other groups there. It's kind of wilderness type schools. And the teachers and the children, they're outside in a national park, right? Wearing facial coverings. All the parents that are coming to pick them up that work at Facebook or Amazon, they have little keypads on them, little swipies, to get into the security of different buildings. They're all wearing N95 facial coverings. So I thought to myself, this is never going to change for these people. No matter what the scientific institutions say, they have adopted these habits. Now, here's the problem with the adoption of these habits. Your willpower is a finite resource. You only have so much willpower. If you spend all of your day, doing work that you don't like because you're working for a company or corporation that doesn't have meaning or purpose for you, and you exhaust your willpower trying to not eat junk food and do all these things, and then you're like, oh my gosh, well, every time I leave the house, I have to put the facial covering on. And anytime I get in the car, I got to use the hand sanitizer. You're just literally burning out your willpower. So then when it comes to the hard times in the evening, right, where the choice is, do I have the ice cream or not? Do I have the cookies or not? Do I overeat food because I'm just stressed out or not? You're going to probably pivot to do, because your willpower is exhausted from the hand sanitizer and the masking, and you're scared of people, and you think that there's this halo effect. You think you're doing all these things for your health by wearing the mask and doing the sanitization and the whole thing, when you're really not, right? If you think about the data. And then what? Then you have no willpower left to actually make, the health choices that will significantly increase or affect the trajectory of you developing a chronic disease like cancer, like autoimmunity, like heart disease. So I think it's really important there is a consequence. I think there is a consequence to all of this masking and the fear mongering. Aaron says, my immune system needs germs to stay strong. Boom, Aaron. This is something I actually want to do a really deep dive in on, is the data on hand sanitizer. Remember, COVID-19 is a respiratory pathogen, right? SARS-CoV-2 is transmitted via aerosolized droplets, okay? Why are people still 2 years later using hand sanitizer? It's insane. I was at Whole Foods a few days ago. Everywhere you go, there's a thing of hand sanitizer. Now, look, lest I remind you, this might be news to some of you. The worst time to use hand sanitizer is actually after touching grocery store receipts, because the ethanol and the different compounds in the hand sanitizer make your skin more permeable. Then you take the persistent endocrine disrupting chemicals, the EDCs, the BPA, and the crap from the receipts, and you transdermally absorb them. So the worst time to douse yourself in hand sanitizer is after you have just bought stuff at the grocery store and you have BPA lined receipts. Do people know this stuff? I mean, or do they even care? Do they even care? Like, literally, are they so concerned? Like, they have tunnel vision about a virus with an infectious fatality rate of 0.61%, but they don't care about endocrine disrupting chemicals that have been linked with cancer, metabolic disease, hormonal disruption. I mean, it's just insane that is going on. I know I'm preaching to the choir. You're frustrated by this stuff too, but it's insane. There should be education around this. And the percentage of like morbidly obese people that I see in the state of Washington, I really feel that the people that got disproportionately affected by all the staying home and the closing of gyms and all this stuff were the people who were already overweight, obese, and morbidly obese. Like those categories they just shifted. I mean, as we've reviewed before, the CDC actually found that various states have increased in those numbers. And in children, which is the worst of all, the people that got severely impacted the most have been children. In fact, I want to share with you a clip from CNN from a doctor talking about this, but obesity as well. So here's a clip from this. I thought this doctor did a great job talking about who should unmask first. And it's actually children. But okay, before I play the clip, you know what you see when you go out, right? You see a middle-aged family. You see middle-aged parents. They're in their late 30s, 40s, right? They're unmasked. But their children, they force their children to wear the mask. Okay, if you're following the science, it should really be the opposite. If you're worried about COVID and you're an adult, especially an adult with a big belly that doesn't exercise and orders crap from the internet, like goes to Chick-fil-A and eats junk food, you should be wearing the mask, but your kid should not. Your kid, statistically, children are at exceedingly low risks for severe disease, long-haul COVID, landing in the hospital and dying. But yet we insist on making our children be the shields for us. We're harming our children so that we can feel safe, which is just a problem. So I don't know who this reporter is over at CNN, but she does a great job of interviewing this doctor about masking the kids. And so here we go.
The CDC says it is reviewing the mask guidelines and will be updating them soon. So what should that update look like for kids? Dr. Janine Noble, an associate professor of emergency medicine and the director of COVID response at the University of California, San Francisco Emergency Department, joins us now, along with Amna Hussein, a pediatrician. Good evening, ladies.
Good evening.
Hi, good
Thanks
evening.
for having us.
So you both have different perspectives on this issue. And Dr. Noble, you told me last week that if anyone is going to unmask, we should let our children go first. And now is the time to get rid of mask mandates for kids in school. Why do you believe that?
Yes, kids are at the very lowest risk from serious health consequences or death from COVID compared to our wider population. They've also endured the longest period of social isolation. In many states, schools were closed for a full 18 months during 2020 and 2021. So as we lift these risk mitigation layers, masking being the prominent one that we're discussing now, kids should really be first in line. They are the least threatened by COVID illness, and they have the most to lose from perpetual masking in their educational environments, trying to understand nuanced speech, read facial emotions. And we have a lot of
as you heard right there, and she happens to be very accurate with that, of course. I mean, she's a physician, she gets it. But this is something that it's crazy that 2 years later, this is now socially acceptable to talk about. Remember when you would criticize the fact that kids are being masked, even though the data really from early on showed that kids don't need to be wearing masks? You were deemed a conspiracy theorist, an extreme right-winger, a MAGA supporter, whatever all that stuff meant, just because you cared about children. Now we're having to argue, we have these arguments, and it's like socially acceptable. In fact, the CDC, this is another piece of news that you might want to be aware of. I'm sure you've seen this news, but this was the CDC had just lowered their standards for speech in terms of the number of words that young children should have known and be able to articulate at a young age. And you might wonder, well, gosh, why are we lowering standards for children? Well, it turns out that keeping kids on screens at home, socially isolating them, and preventing them from learning language by covering their faces and their teachers' faces have consequences. Now, a natural question to ask after understanding this sort of thing and realizing that there are unintended harms associated with masking children, especially in school and so forth, is, well, what are the long-term ramifications of this? If you have developmental delay, do you ever regain that? And I do feel that the brain is very malleable and plastic, and we can learn and we can overcome temporary shortcomings, especially in young children. However, I think it's natural to be very concerned about this. And it's crazy how quickly we implemented all of these things. We closed the schools, we closed the gyms, we made everyone wear masks. This was quick. Yet we have data to show that there are consequences for our future generations. But yet we're still arguing about this, even though the data overwhelmingly supports the fact that children, although even unvaccinated children, are at exceedingly low risk for severe disease, complications, and death. But yet we have to argue and present data in these, and then go back and forth and pontificate whether or not it's time. But as this doctor you just heard, an emergency room physician, says, the first, the unmasking of America should actually be in sort of a stratified age, consideration, risk factor consideration rollout. The messaging from the CDC should be, if you're young, if you're healthy, especially if you've already had COVID, take your damn mask off. If you're worried about this, if you're overweight, you have risk factors, blah, 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 then perhaps you should keep it on. That should have been the guidance from the get-go. But we were promised if we all do it, it's going to flatten the curve. There's actually another piece that I wanted to share with you if I can find it. I did save this on my computer, but I might not have time to actually look at this. And this was the viral load in wastewater. What I thought was quite interesting, and the CDC collects this data, and that was part of what the New York Times was being critical of, is the viral load in wastewater. And I'll have to share this with you another time, but you could actually see the Omicron surge and the viral load increasing in early November in wastewater. In fact, the viral load of the wastewater had quickly in November of this year, before the Omicron was announced and the whole variant was delineated and so forth from scientists in South Africa, the load in the wastewater started to increase here in the US. I'm not talking Omicron specific, just the genome in general is, I believe to the best of my knowledge, how that's quantified in the wastewater. It had surpassed Delta. So the fact that, it took the White House and so forth so long, they didn't start rolling out test kits and masks until the end of January. So again, you have basically, 60 plus days where it's like you started to see this change in the signal, and there wasn't an associated policy change or sort of urgency there, which I thought was quite interesting. Anyway, lots of interesting comments here. So let's get to your comments. Eric says, in the state of Illinois, kids are not going to have masks being rolled out. Okay, we have vitamin D3 above 50 nanograms per ml when having severe COVID is better to prevent. But I think having vitamin D levels that are so-called supraphysiologic is a piece of the puzzle. Is vitamin D the sine qua non? Is it the only thing that's going to influence COVID trajectory? Probably not. But I do think it's a huge piece of the puzzle for sure. Now, going back to this article that I was just referring to in Science Magazine, highlighting that severe COVID-19 and people who actually succumb to the infection, part of the sequela or the disease pathophysiology is a manifestation of an extreme autoimmune-like reaction. And so this is where vitamin A and vitamin D come into the equation from an immunopathologic standpoint, is they do help to induce a sort of immune tolerance. They induce immune tolerance. And so I think this is a big mechanistic reason behind the purported benefits from an immune perspective, specifically in this context with regards to vitamin A and vitamin D, is by changing the tolerance of the immune system. And so if you have an immune system that's very intolerant and overreactive to self-tissues, which as this article eloquently speaks to, then that would make sense as to the supportive benefits of vitamin D. Okay. Joy80 says, Mike, can you explain why some people never get the Rona? Good question. I am one of them, as is my husband, also other family members who live in New York. Joy, really interesting stuff about why certain people do and don't get it. I do just want you to know that I actually did a video on this about a month and a half ago. And this was, it was a family got their antibodies tested, and we did talk about that. But in brief, it seems that there is some structural similarity with other beta coronaviruses, with SARS-CoV-2. There's enough sort of homologous features. And what by homologous, I mean by shared or related proteins and proteinaceous compounds and immunologically reactive elements of, say, coronavirus HV229E. So this is, you can Google this, 229E, it'll pull up another coronavirus, and SARS-CoV-2. So if you're exposed to a common cold, and studies have actually found this out in various, I don't know if it was Cleveland Clinic or Mayo or what university did this. Maybe it was in the UK. I can't remember the reference, but they actually looked at this and they talked about how certain healthcare workers could abort an infection where they could get exposed to COVID, but they never get infected because of the shared immunologic memory from prior exposure to a related coronavirus, but not SARS-CoV-2. And this is, I think, again, something that we could have quantified this with a T-cell assay or some such to help people better understand, the relative risk there and so forth. And the analogy or sort of the case history that I shared with you, case study, was a family friend, a neighbor essentially, who got COVID. Okay, the husband got COVID. I shared this with you, and we did their antibodies and T-cell immunity. Husband got COVID, was sleeping in the same room. They were skiing on a vacation in Canada, actually, or something. When the husband got COVID, they isolated and all that. The rest of the family didn't get it. They all got vaccinated except for the kids. The husband then got Omicron, but the wife, who's a nurse, didn't get Omicron or COVID before. And so we speculated that she fit into this category where, because she's around children all the time in her profession, working with children as a nurse, that she's probably exposed to a lot of different pathogens. And there was enough shared structural similarity between those pathogens and offered like a little bit of an advantage so that when she was presented with SARS-CoV-2, the immune system, specifically her T cells and memory T cells, were like, you know what, I think we've seen you before. We know how to take care of you and deal with you from a cellular immune standpoint, which is how T cells function in the adaptive immune system. So I think there is something to that. I think it's a really interesting point. Stefan says vitamin A helps the baby white blood cells specialize into macrophages. Stefan, great point. Vitamin A and retinoic acid is phenomenal. Really good point. Fabian says, I would never let them use masks all day and hack their immune systems. The masking the kids all day it's just really bad. I think another point, one of the unintended harms associated with masking that has been really overlooked is that mask wearing fosters mouth breathing. And if you're not, sort of up on this, the Mew method and myofunctional therapy and the whole thing, when you're developing your face and your jaw, it's your tongue position and how you breathe, whether you're breathing through your nose primarily or your mouth, really actually influences the shape of your face. And not only the shape of your face, but the size of your airway. So when you're constantly breathing through your mouth, you're actually fostering non-aesthetically pleasing looking formation of your jaw muscles and face. So it's really important for a myriad of different reasons to get the kids out of masking. Because I don't know about you, I'm naturally a mouth breather, but I've trained myself with myofunctional therapy and mouth tape and being more intentional about breathing through my nose to become much less of a mouth breather. But I find myself when I have to wear a mask on an airplane or at a store that's just like a mask zealot store, I find myself mouth breathing a lot. And I don't think I'm unique in that. I've talked to a lot of people who are keen on the differences between nasal breathing, which is what you want. You don't want to be breathing through your mouth. Check out Ask the Dentist, Dr. Mark Behenna. We've done a lot of videos with him over the years, but really important stuff. So anyway, we can go on and on about this, but Scotty Mack says, question, hey Mike, advice for chronic nausea and headaches and blurry vision 5 months after vaccination. Okay, Scotty, I don't know exactly what to do, but here's what I would do if I was in your situation. I would find hyperbaric oxygen therapy. So I would go to like maybe 1.5 or 2 atmospheres, get in the chamber. I think that could help with the neurologic inflammation. That could be part of what could be happening there is some sort of, the S protein could be triggering some neuroinflammation. And we know that HBOT hyperbaric oxygen therapy can be very helpful. And so I would suggest that. I would also suggest going in a sauna. We know that sauna therapy and heat therapy in general is good for the microvasculature. It seems that based upon the data that I've read, whether you get naturally infected or you get exposure to the spike protein by way of immunization, that the microvasculature can take a hit. Not in all people, but in some people. And that might be part of why there are, adverse events in some individuals. So going in the sauna is a great exercise for your microvasculature. So that could be something that you could consider. Walking would be another great thing to do. If you could do, breath work, I think might be sort of helpful. Changing oxygen saturation dynamics by way of hyperventilation followed by retention breath work can be helpful for the microvasculature and breathing dynamics. From a supplemental standpoint, you might want to consider N-acetylcysteine. You might want to consider coenzyme Q10. You also might want to consider curcumin. Curcumin could be helpful for the neuroinflammatory sequela. T says, Mike, did you take the jab? Come on. What do you think? What do you think? Okay, I'll let you guess, okay? I got exposed in 2020 to the real thing. I've demonstrated to you all and to family members that I have antibodies and I have T-cell immunity. I didn't feel that it was necessary to then get additional protection. So I didn't. But you know what? I don't criticize anyone for getting it. It should be a personal choice. People can do whatever they want, right? If you want to go get a booster, a fifth booster, a 10th, whatever. I'm more of a libertarian. What you're doing is not going to harm other people. It's your body. You can do whatever you want. And as such, I decided that I didn't need that additional layer of protection. Now, interesting story, since you asked about my vaccination status, which I encourage you to ask. Yeah, it's cool. Go ahead, ask. What a vaccine that I have gotten in the last 2 years is actually the tetanus vaccine. So I do a lot of home construction. I went to the doctor in 2019 to get a diagnosis for an inguinal hernia. And she asked me about my lifestyle and all this sort of stuff. And I told her, that I built a sauna, a shed, decks. I do home construction. She goes, you should really get a tetanus shot. I was like, well, why do I want to get a tetanus shot? She goes, well, look, if you step on a rusty nail and you get tetanus, there's no treatment. I thought, really? There's no treatment for it? Like, we got treatment. She's like, no, it's pretty bad. And you know what? I've stepped on nails before, so I went and got a tetanus shot, right? So I had this idea to do a video and be like, hey guys, I got vaccinated, and not really tell you what vaccine it was, and then tell you the reasons why I decided to do that. But I'm actually really glad I got this tetanus shot, because guess what? About 4 months after getting the shot, I stepped on a gnarly screw. And it actually damn near infected my foot. It was swollen like crazy. And this was a rusty, gnarly ass screw. So like I said, not everyone needs a tetanus shot. Like if you're not working outside or not building stuff, you're not stepping, or there's the probability of you stepping on rusty nails and screws is pretty low, right? Maybe that wouldn't be a good idea for you, but it happened to be a good idea for me. So I just share that story with you because I think we should all do risk-benefit analysis and think about our exposure and probabilities of severe disease and all that. And I think that's how the vaccine should have been rolled out. These recommendations based upon age, underlying health conditions, and all that. And I think there would have been a better uptake in the people who actually could have really benefited from them. But you had this tribalism and this stuff going on, which anyway. So interesting stuff. What else do we have? Okay, Aaron says the same thing. Tetanus is the only shot I've had in 2 decades, right? Cool. So, look, if you're outside and you're exposed to rusty nails, dude, it sort of made sense. Made sense to me, and I think it makes sense to others. Okay, let's see here. What other questions do we have, y'all? Anyway, also, my friends, thank you for being here live with us for a Fear Mongering Friday. If you're here and you're enjoying this, hit that like button. That just tells me whether or not, honestly, I go and look at the analytics, and if engagement isn't good, then we won't do this anymore. But I just want to know from you, should we continue to do these? on Friday at like 5:30, let me know. Immortality Evolution says the bacteria doesn't live in rust. Right. I don't know all the pathophysiology of tetanus and is it botulism toxin. I don't know all the mechanisms. There's probably dirt and stuff in the soil, bacteria that's sort of, I don't know. But the rusty nail infected the hell out of my foot. I'll just tell you that. Okay. Fabiana says, do you know that tetanus is never found in metal? It is easier to have tetanus from glass. Fabiana, I didn't know that. Like I said, all I know is that I got a foot infection and whatever. So, but that's good. Thank you. I see. It's good that we can learn from each other. I don't want this to be a one-way street where I'm just sitting here lecturing. I don't know everything. There's a lot of stuff I don't know about. Tons. In fact, the stuff that I do know a lot about is like this much. There's like so much that I don't know. So much. So thank you, Fabiana, for sharing that with me. What other questions do we have? Oh, you know what? I got to share something with you. So my mom, who's 66, she just turned 66, was in town this week. And she got a cold. It turned out to be a pretty bad cold from my nephew. She's already had COVID. She had COVID in January. That was her birthday present, was getting COVID. She got Omicron. She's unvaccinated. She's fine. But she had this cold. And it was lingering. And I gave her the iodine. I gave her, all the things that I would normally give to, recommended vitamin D, the whole thing, right? She couldn't kick this cold. And so last night I said, Mom, I'm going to get the sauna started for you. We have a wood burning stove in our sauna. It gets super hot. I'm like, Mom, just stay in here, relax. I'm going to get it really nice and hot. I got the laoli or the rocks on top of the wood stove. I got those really hot and I started to pour water on the stove and put essential oils and eucalyptus essential oils in there and got it super hot. She was in there for about 45 minutes. She's like, I don't know if I can stay in any longer. I said, go ahead, take a break, then come back, do a couple rounds. Amazing experience. And because she's traveling today, she's going back to California where she lives. And I reached out to her this morning and she's like, dude, the cold's gone. Like she was going to cancel her flight. She was going to do all this stuff. Of course, I got to say for our legal friends here, sauna therapy and everything we talk about today, friends, cannot diagnose, cure, prevent, or treat illness. You need to work with your healthcare practitioner. But I will say that in my mom's particular situation, she had a really bad cough, really bad cold that didn't seem to want to go away, and simply taking a really hot classical Finnish sauna, it seemed to kick her cold. So that's something that, honestly, with all the money that we spent on all of our safety mitigation strategies, if we would have built community saunas and like had people go in there like with their families and stuff, like we could have really influenced people. And if you look at Nordic countries and so forth, I think it seems inarguable to think that saunas couldn't have made a difference. I think they really did make a big difference. Okay, Fabiana, I will definitely check that out. Thank you for that. Jennifer says, would you recommend the sauna for low oxygen levels after COVID pneumonia? Yeah, you could. So Jennifer, the sauna is more going to help with blood flow. Remember, sauna is essentially the heat. It's exercise for your endothelial tissue, which is basically the functional unit of your cardiovascular system. So it's going to help your blood move and move around. So it's going to be helpful. Is it specifically going to target the low oxygen saturation? Probably not. That's going to be something else that you can do that you can do with exercise, walking. Hyperbaric oxygen therapy might better help there. Okay. Immortality Evolution says, I bought a sauna with the stimmy. Good for you, man. See, that should have been recommendation. Hey, you're getting a stimulus check? Invest in your health. We encourage you to do that. Stephanie lived in a sauna for a year, assuming that you've done this. And Stefan says, I need a sauna, but they closed them all due to COVID. My gosh, that's probably the safest place in the gym or the fitness studio. So, yeah. Well, friends, as always, like I said, I'm grateful that you're here. Thanks for being here. Thanks for hitting that like button. Thank you for watching all the way through. If you're watching the replay, that really does mean a lot to me. And hopefully there's not a World War III. I mean, my gosh, that would really suck. But we always got to ask questions. We always have to think about the timing of all these different changes in policy and ask questions about that. But as always, have a great rest of your day, great rest of your weekend, and we'll catch you all soon. Have a good one. Bye now.